This is Forum 360. I'm Sally Henning. Who can restore sight to the blind? Our guests have been working on that, and they have been working to restore sight to people who have lost sight due to the ravages of strokes. First, we have Dr. Todd Fladen and Dr. Abbas Sadeghian. We welcome you to Forum 360. First of all, Dr. Todd Fladen is the medical director of the Fladen Eye Center in Canton, Ohio. Dr. Fladen has been performing life-changing vision correction procedures since 1981. He received his bachelor's degree from Emory University and his medical degree from the Ohio State University School of Medicine with specialization in ophthalmology for medical and surgical treatment of diseased eyes. Dr. Fladen completed his fellowship in corneal transplantation and refractive surgery at Wills Eye Hospital in Philadelphia, and he is board certified and a diplomat of the American Board of Ophthalmology and a diplomat of the National Board of Medical Examiners. In his spare time, he works as an associate clinical instructor at Northeastern Ohio Medical School. Dr. Abbas Sadeghian, welcome also, is a research neuropsychologist who works with Dr. Fladen, and Dr. Sadeghian came to the United States in 1976 to study psychology. He received his master's degree as well as his PhD in psychology from the Alliant University in San Diego, California, and he received his postdoctoral degree in neuropsychology from Fielding Institute in New York. And over the years, he has worked in a variety of areas of psychology in private practice and at local hospitals. Dr. Sadeghian has authored several books and articles and developed different treatment methods for stroke patients. During the last 16 years, Dr. Sadeghian has been working in the area of visual rehabilitation of patients who suffer from hemianopsia, which is the loss of vision due to stroke. He has, working with Dr. Fladen, developed a promising treatment method for this condition, which is called visual chromatic cover therapy, and it's currently going through the last stages of research and clinical trials. Dr. Fladen, Dr. Sadeghian, welcome to Forum 360, but first of all, what on earth is hemianopsia? Which is easy for me to say.
Hemianopsia comes from the Latin word hemi, which is half, an, which is not having, and opsia, which is sight. So these patients have lost their sight halfway. That means they either have lost their sight on the right side completely, or they've lost completely their eyesight on the left. It's not blurry.
And this is because of a stroke.
This is because of a stroke or any type of situation where there's decreased blood flow to the brain, which ultimately causes cell death. And it has to affect the final stage of vision, which is in the back of the head, the occipital lobe we call it, where the vision center. There's a vision center on the right, and there's a vision center on the left. The right vision center on your right side affects vision on your left, and vice versa. The left vision center affects it on the right. So if the stroke, if you have decreased blood flow to the brain, because let's say there's a blockage from atherosclerosis,
or a stroke.
Or stroke would be the ultimate result. So ultimately narrowing of the blood vessels, which is why we're on statins in order to get our cholesterol lower, to get the fats lower that are in our body. If that narrows the blood supply to the brain enough, therefore the patient, there'll be cell death, and that cell death then is called a stroke. That's what it comes down to. And it's been known about, they've been describing strokes way back before Hippocrates, a couple years, 200 years BCE. And this problem is a problem that affects millions of patients each year. It's estimated up to 10 million patients a year suffer from stroke. Of those, 800,000 people suffer from visual compromise. 650 of those 850,000 are first-time patients with stroke. And the other 150,000 are patients who've had recurrent stroke. But what we're trying to deal with, what Dr. Sadeghian's research is striving to do, is to rehabilitate the deficiency of loss, the complete loss of vision either on the right side or the left side. There's a secondary effect which he'll talk about, but that in essence is what's going on.
So Dr. Sadeghian, how did you two meet and how did you end up working together in this research project to rehabilitate visual loss after stroke?
Well, I came up with the idea about 16 years ago. A research came out which showed that when you have probably noticed that when a person has a stroke, they become weak on one side. And along with that weakness, there is also the heminopsia, the problem with the vision. So if a person is weak on the left side, they have difficulty seeing things to the left. We had a treatment for other parts of body, which was called constraint therapy. So for example, if the left hand is weak, we put the right hand in a sling so that they cannot use this, so the person is forced to use the left side. That is called movement constraint therapy. I thought it was on the millennium that research came out that this was quite effective. I thought that how about if we try that for the eye? And the way that I did it was that I would block the good side, forcing the bad side to work.
So is this a method of helping people who have had strokes to be able to regain vision?
It's awesome because they not only, in most patients, not only do they have loss of vision on one side, and let's stay specific. If you have the left side of your brain, the visual center is affected from decreased blood supply, then they'll lose vision on the right side. And they likely will lose motor function on the right side too, either their arm or their leg. And they also will have impairment of the ability to speak, because speaking also is affected by the left brain. And so when you're asking somebody a question, they can understand what you say, but they can't give you the answer. They have that difficulty. As opposed to the other side, where they completely ignore, in other words, in the right visual center or the right part of the brain, is the area of knowledge of knowing what the object is. So you could hold a pen out and say, what is this? And they'll have difficulty recognizing what it is. But not only do they have physical disability, but they have emotional disability. So depression is dramatic in these patients. It's absolutely dramatic, and logically so. And it affects their employment, because when they have a heminopsia, then they can't drive. We don't have driverless cars. It's going to be probably 10 to 20 years until you can go buy a Ford Fusion, for under $20,000 with a driverless capability. So we have a long way to go. And so restoring vision is the most important aspect, not only as an ophthalmologist, but as a general physician, and certainly as a neuropsychologist, is what we're striving to do, and what we're trying to prove based upon the patients that we've worked on thus far.
So what are the past and current treatment methods, and how does your treatment differ from what other folks have been doing?
Well, in the past, basically there is no treatment. They have tried everything, and there is no surgical or any other type of treatment for it. The other, treatments that they have come up with, it has had very little experience, positive results, and usually it is temporary, goes away. The one that we did initially, which was the constraining, totally stopping, covering the area which was bad, it had some good results, but again, it was not very good. They usually would gain the vision, but it would go away. It was not a permanent treatment. So this 16 years was spent trying to come up with some other method of doing something to glasses without messing around with the eyes themselves, so that we change this, we treat this. And I tried lots of things. I drove everyone in the city crazy. Then I came up with the idea that how about if we just go ahead and cover that area rather than totally blocking it.
To cover the area on the glasses,
Yes,
okay, of patients.
yes. Cover it with blue color, which is translucent.
Okay.
This is an entirely different concept, meaning that we try to get the information to occipital lobe, just how Dr. Fladen mentioned, but using the routes, which is the pathways, which is for color. And it was miraculous. It was very nice.
So you're using tinted lenses on
Yes.
eyeglasses of patients.
Yes. And the good thing about it took many years until we could come up with the proper paint and method and so on of doing this, so that it is totally harmless and does not cause any kind of a problem. The person can see, would not run into walls and this and that. And we would see that within 2 weeks, that the results of the visual field exam would show that the person is seeing better.
Are there particular people that are more susceptible to positive results? Are there particular kinds of stages of stroke that render you more able to help people than others?
During the first year, most of the improvement that you get out of a stroke, regardless of the damage, is the first 4 months. And by the end of the first year, wherever you are going to be. So doing any kind of a therapy during the first year, if it gets better, you might be taking credit over what we call a spontaneous recovery, something which was going to get better anyway. But after 1 year, wherever the patient is going to be. So those were the kind of patients that we chose. So we're not getting credit over something which is going to get better anyway.
You're not saying that you couldn't help them. You're saying that you look for patients that other doctors had said were beyond the part of being helped.
Yes.
Okay.
Everybody has tried everything has been done. The patient, most of them are on disability because they cannot drive. And
So your focus is working with patients that have already been ruled to be beyond help. They're at their maximum amount of approval,
Yes.
of improvement. They're at that point.
yes,
Okay.
the
Well,
patient-
so you've been tuned into Forum 360. I'm Sally Henning. Our special guests today are Dr. Todd Fladen and Dr. Abbas Sadeghian, who have been working to restore sight to people who are blinded due to stroke. And we were just talking about who are the type of people that they focus in on. And you're talking about dealing with patients that other people have written off.
yes.
So Dr. Fladen, tell about your program and what sorts of patients might be eligible. Is this called a clinical trial, or
We're in preclinical trials.
okay?
Okay, before we were actually in preclinical trials.
You go from pre to pre.
Well, initially the thought was Dr. Sadeghian had this thought. He's been working on this for 10 to 15 years. And then he brought me, we both came from the neuro rehab unit. Patients who've had stroke go to a rehab unit, they have much greater likelihood of rehabilitating that limb or their vision or whatever. Most rehab centers don't deal with visual rehabilitation of any type, and there's no visual rehabilitation that's effective in any event. In our classic training in medical school, as well as in ophthalmology residency programs, there's no effective therapy other than trying to put some type of a prism in glasses which moves the image from the side that can't be seen into the side that can be seen.
So what you're doing is a bit revolutionary.
It is. So ultimately we tried it on a number of patients, probably up to 30 patients, to get a somewhat of a sense, can this work? and we found out that it did. We can't actually quote you the number. They were of various ages. They were at various stages. It wasn't really a standardized test. So now we're looking specifically for 5 individuals who've had a stroke, where they're at least 1 year from that date of stroke and still have residual hemianopsia, still have residual loss of vision on either their right side or their left side. And there's a lot of these individuals in Ohio. As I said before, there's 800,000 people in the United States last year who had a stroke. So we're looking for those individuals. And at 1 year, 27%, that's 1/3 of these individuals, 1 out of 3, still have a hemianopsia or a partial hemianopsia. And those are the individuals that we're looking for, 5. And then we put them into a strict protocol. Once that protocol has, we can base conclusions or non-conclusions that it doesn't work, but we strongly feel that it does work based upon our prior experience that it does work, then we set up an FDA trial.
Do you have a website or something, so if people wanted to get a hold of you to say that they had had such a vision loss and a stroke and vision loss, and they want to get a hold of you, or they had a relative that they wanted to get involved in treatment, where would they contact?
The best thing to do, because it's hard to remember, it would be go to either to the FladenEyeCenter.com. We don't have yet a specific website that's set up for the VCCT therapy, or they can just call my office and talk to Dr. Sadeghian, Dr. Sadeghian's office as well, at 330-489-1441.
And if people contact you concerning this, who are the candidates who would be excluded? If someone has had a stroke and they have visual loss, or there's some people who would not be eligible?
There's age. We're looking for people that are 18 years to 75 years. We're looking for individuals that have stroke. We're not looking for individuals that have had trauma or have had a tumor of the head.
You're very specific. Is what
Correct.
You're for. Yeah, so they have to be over 18, have to be under 75.
Correct. They have to have had documented evidence by MRI that our neuroradiologist confirms is due to a stroke. We have to have those MRI films and report from their hospital as to what it is, and then we'll review that to verify it. And then we have to do a baseline visual field test that shows that they have a hemianopsia or partial hemianopsia. Lastly, we have to prove neurologically that they're intact, that they don't have any signs of dementia or Parkinson's disease or Alzheimer's or any other hereditary disease. And they don't have any, and that they also have a healthy eye. They don't have any evidence of any ocular disease such as cataract or glaucoma or macular degeneration or any hereditary disease.
For which there may be other solutions.
For which there would be other solutions. This would not work for that.
Yeah, so it's not, this isn't a meal for everybody. There are very specific folks that you're hoping to be of use to, and there may or may not be treatments for folks with other issues or other concerns.
Yes, and something which has happened recently is that unfortunately, a lot of soldiers who have come back from Afghanistan and Iraq, because they have been in explosion situation and they have had head injuries, they have this condition.
So you don't think of soldiers as having had strokes? Do you tend to think of that as being something for people my age?
It could happen to anyone, but the two specific population that we are dealing with now, which is the majority, is one, patients who have had a stroke, and the other group are patients who have come back from combat. Okay. And in those cases, they are young, and their condition, I mean, it is serious. They can never go back to work and so on. And if our program proves to be true and we put it through FDA, get FDA approval and so on, it will be really helpful in that area as well.
Yeah, I just don't think about young people, soldiers, as having strokes? Would that be from being exposed to explosives or
Well, there's
trauma?
without getting too technical, there's two types of strokes.
Okay.
There's the type where there's narrowing of the blood vessel. That's called ischemic, where the blood flow doesn't get to the brain. Much like a heart attack, blood flow doesn't get to the heart. Those are heart attacks, number one cause of death, stroke, the number two. Both the same degree where there's a blockage of blood flow. But then there's a second type called hemorrhagic, and these people could have irregular vessel formation or aneurysms. Those can occur where there is spontaneous bleeding into the brain, and those individuals tend to be young. So we can help those individuals. And that's important because they have a long life to live.
So your process is not yet FDA approved? Or,
No.
No, so that's what you're working on now. It's part of a preclinical trial. How often are patients seen, and what is the cost to people?
Well, this is where we really need your help. I've had patients who called from Hong Kong, Indonesia, and we were able actually, in collaboration with their own doctor in the other country, to do the treatment for them. But in order to be able to put this through FDA and make it something which is available for everyone, we need to do a pilot study, which is, as Dr. Fladen mentioned, is totally controlled, totally standardized, and so on. Once that 5 patients done, and I need your help to recruit that, it is totally free, and it is not only a help for the patient, it is a good help for the society, for other people who have this. Once this is done, then we can do a larger study and under supervision of FDA and get FDA approval for it and present it to the medical community. We do have patients who have got better, and so we know that in many cases it works. We have to just standardize it, and for that we need your help. We need 5 patients.
So you need people to know about it.
Correct.
You need people to know about the option of this kind of treatment, and the more people that know about it, the more people refer people to you, the more you're able to push forward with the treatment. So there's no cost to the folks who contact your center and say they would like to get treatment.
No, and I'll be more than happy to talk with them initially on the phone in detail, and then we do extensive testing, both medical and also neuropsychological, checking different aspects of vision. Then we do the treatment, and within about 2 or 3 weeks we know if the person is going to respond or not.
And how often will the patients be seen by you who indicate they're interested in proceeding?
They'll come for the initial baseline exam, and they'll see both of us.
And this is non-invasive. It's not surgery, right?
It's not invasive whatsoever. It's much like a routine eye exam when you go to your eye doctor. Only it's a little bit more sophisticated because we're using high-resolution imaging to verify the eye is normal. And then we're doing cognitive behavioral testing. Dr. Sadeghian can talk to you about that.
Yes, we check several different things like facial recognition, hand-eye coordination, visual organization, many aspects of vision. We'll check all of those, and experience has showed to us, which this is a secondary gain which comes, that it is not just that the person's vision gets better, that there are additional benefits from it.
Well, changing the subject a bit, what advice do you have for children who might want to go into your fields of study, or who might want to be interested in a career of learning to restore sight to those with visual impairment?
Well, let me answer that, but quick, I just want the audience to know this, that if you have the disease, or you know someone has the disease, call this station and they will get a hold of us, or call our number 330-489-9494, 1441, and we will take care of you.
And it's the
And the Fladen
FladenEyeCenter.com.
Eye Center. Ultimately, giving back vision, the gift of sight, is a very inspiring experience. And those of you, anybody out there who's a youngster, certainly in high school, that's interested in pursuing that as an occupation, give us a call. You can come to my office. I'll mentor you. We want you to go into that specialty.
Very exciting.
Yes, and I need to emphasize this thing that it is, beside being free and getting a comprehensive exam for no cost, we have done it for so many years, and we have never had even one case that any kind of a harm has come to any patient or their glasses.
Or the glasses.
So it is.
Restoring vision to people who are blind, to people who are victims of stroke. Dr. Todd Fladen, Dr. Abbas Sadeghian, on behalf of Forum 360, thank you for being our guests today.
Forum 360 is brought to you with support from Electric Impulse Communications, Kim and Harvey Nelson, Rubber City Radio Group, Acronist.com, Hudson Cable, Medical Mutual of Ohio, Forum 360 supporters, and the Shaw Jewish Community Center of Akron.